something that I left out of the introduction video, and that is I will actually be recording our chapter lectures weekly as we progress through the semester. The primary reason for this is that it allows me to use the video to address any common issues that are that are occurring within the course. Um, I've done my best to set this course up error-free, but things happen. Sometimes quiz questions get coded wrong, or I may have left a due date from a prior semester. This recording these videos weekly just gives me an opportunity to address that all for you and give you any modifications that are needed. The second reason I like to record lectures as we go is it gives me an opportunity to tailor the lectures to your needs. I found that every semester and every group of student is different, and they connect with different information in the text, uniquely on your own. So this just really gives me the opportunity to customize these lectures to what you are struggling with, or to highlight formats that you may all prefer, okay? So obviously my intention will be to upload these chapter quizzes so they're available to you when the module opens on Monday. The latest that I would prefer to upload a lecture would be Tuesday morning. And that hopefully will be rare circumstances where I just need to do some work to get everyone's grade finalized so I can release that information with the video. Of course, I'm holding you all to a really high standard regarding late assignments. So I hold myself to the same standard. So unless something, really unpredictable happens, you can expect your chapter quizzes or your chapter lectures to be available when the module opens on Monday. Okay, let's get started with this chapter. And just as a reminder, I am not going to read every slide within this lecture. I'm not going to discuss every little subcategory in the book. The purpose of these lectures is just to clarify some information and to highlight some things that I think are really important. You are still responsible for all of the information in this lecture and on this PowerPoint, but also all of the information in the textbook. Okay, so just because I don't go in depth about a particular topic in the textbook doesn't mean that you're not responsible for it. You should consider all information in this textbook important and fair game on the quizzes and the exams. All right, so we're actually going to skip a few slides. You can read the learning objectives, you can read these definitions on your own, and we're going to talk about the perspective that we're really going to use to create the framework for the rest of this course. And that is the lifespan perspective. Really simple, this perspective divides human development into two phases. So we have early childhood development, which some of you may have had the chance to take with Dr. Rainey or Dr. Day. And then we have the later years in life, young adulthood, middle age, old age, and that's really what we're going to be covering in this course, young adulthood and on. So the lifespan perspective, I guess we call these features. Okay, the lifespan perspective has 4 features. Multi-directionality, really just a simple way of saying that development involves both growth and decline. So as you age, you don't get worse at everything. You don't get better at everything either. Okay, you might become really good at giving advice because of all the knowledge and the wisdom that you've accumulated, but you're probably going to get worse at sprinting. Okay, and those are 2 pretty extreme examples. So this multi-directionality happens in very small ways, and we'll discuss that throughout this course. The second feature is plasticity. Your capacity to learn, your rate of decline, your rate of growth, it's not predetermined, right? It's not concrete. It can change. Skills can be acquired. You become faster at some things. As you age, well into old age, you're still able to adapt and grow because your brain is plastic. And then, of course, we always, always, always need to consider cultural and, in this case, historical contexts, right? So living and the way you age is much different today than it was, in the early 2000s, and even more drastically different than it was in the 1900s, even as soon ago as the 1990s. How people age, the factors that they had to deal with, the toxins that they were exposed to, the ideologies that were important for them as they were growing up, those are all different, right? They're all within a historical context and a cohort that is specific to really every individual on their own, okay? And then, of course, we always have to talk about multiple causation. So, how people develop, how they age, it depends on a wide variety of factors, which is really common sense, right? And that is, if you read the syllabus, which you should have because you've got a quiz due, you'll see that I like to talk about aging in a biopsychosocial framework. That's just a fancy way of saying that we're going to discuss how your changes biologically and physically also affect your mental well-being and the way that you interact with others and your environment. Aging cannot be discussed in terms of just one of those factors because all of them interplay. They all affect each other in this multi-directional kind of web. To build on this lifespan perspective, we also had another researcher who wanted to take it a one step further by discussing culture. So really, everybody is going to age. Everybody is going to, grow older. Some of us are going to get sick. Some of us are going to age gracefully, hopefully. But all of us at some point will probably struggle with how we interact with our community and some of our cultural resources. So this particular researcher explained this occurrence by these three little bullet points that you see here. His first observation was that as people grow older, their physical concerns become so prominent, their health concerns become so prominent that they start to kind of get rid of, or at the very least withdraw from, kind of factors that aren't deemed necessary for functioning. And I see this all the time when I'm at work. So one of my members has COPD, which is a lung disorder. And she is very worried about, having to bring her oxygen with her and people seeing her hooked up to her oxygen machine. So she's really withdrawn from the community and stays inside of her house. One of my jobs as her case manager is to get her back out into the community in a capacity that makes her feel comfortable, right? So the second factor is that people are going to optimize their behavior. They're going to choose the best route, the best version of themselves by focusing on this limited set of abilities that they now feel is all that they're capable of because of their aging or because of their illness. And also, his last factor is that most of the time, people are going to try to create workarounds for these issues, right? In a perfect world, if you're not, in a nursing home or living in an assisted living facility without any family nearby, that member that I was talking about who has COPD, she might not go to bingo anymore, but she might be able to invite her friends to her home to play bingo, right? There's always going to be some workaround that people are going to attempt to achieve before withdrawing completely. Right, and the importance of this one theory, this lifespan perspective, and this little extension, is really going to set the framework for what we're going to talk about throughout this course. So you can expect every chapter to kind of come back to these main points, this multi-directionality, the plasticity, the historical context, the multiple causation for disorders and changes, and also how people interact with their environment based on this extension for cultural value. Okay. Okay. So we're going to keep moving past the demographics. These are really good graphs that you can find on page 5 in your book. So I'll let you all check these out on your own. Okay. Yeah, we can talk about diversity for just a little while. Um, diversity is obviously like a really hot culture topic to talk about, especially in psychology. Cultural culture is vastly important. It influences every single part of your life, every single part. And we find that older adults, you know, they age differently based on their culture. But oftentimes, just being an older adult is kind of they're lumped into this same kind of demographic. I see this a lot because I've worked for a managed care company and we're contracted with Medicaid. So most of the time, my members, they just fall into this really blanket category of they're this old and they have this disorder, so we can give them these services. They don't really take into account all of the diversity that people still hold on to as they age. So really all this is trying to tell you is what you already know, that everybody is different. Okay, so we're going to move into some of the discussion with like research issues. What problems do researchers face when trying to describe, discuss, and analyze adult development and aging? So we talked about this. This is our biopsychosocial framework. It also has some life cycle forces, which you'll get to read about in your book. Okay, so our first kind of issue that we run into are these developmental influences. Just trying to find this section in the book. I've got the book next to me as we go along to make sure I don't misinform you all. Okay, so this normative age grade influences, if you're following along in your book, is on page 9. And these are experiences caused by biological, psychological, and socio-cultural forces that occur to most people of a particular age. So these are normal experiences of aging. Okay, we know that most women experience puberty around the same age. And we can also predict later in life, most women are going to experience menopause around the same age. That would be a normative age graded influence. A normative history graded influence are events that most people in a specific culture experience at the same time. So my generation, I was maybe in 3rd or 4th grade when the Twin Towers fell for 9/11. So that is going to be a history graded influence that was unique to, that kind of cohort of people. Some other normative history graded influences can also be like particular stereotypes that can be common within, a cohort. So people who are a little bit older than us, we all know them. They've got unique biases or prejudices that really guide their behaviors. And us, as a generation younger than them, we don't quite understand it, and we certainly don't practice some of them. All right, so those are all history graded influences. And then non-normative influences are random or rare events that might be important for a specific individual, but are not experienced by most people their age. So, a really positive one would be if you won the lottery. If you won the lottery at 25 years old, that would definitely change the way you're going to age for the rest of your life. You're going to have money to take care of yourself. You're going to live in better conditions. You might be able to pay all of your medical bills, pick up prescriptions. That having that money available to you early on in life is going to change how you're going to interact with other resources in your community, and have access to things that are going to benefit you and allow you to age gracefully. And then, of course, culture and ethnicity always. Culture is just really a way of living, shared norms and beliefs and habits that you have with the people around you. So we have both solid and fluid qualities of ethnic group identities. We have some that are more or less permanent, and then we have some that kind of change. They may be more prominent in certain areas, like the Bible Belt, but are certainly experienced within the culture of America as a whole.